Let's talk about that pain spasm, pain cycle, and take out the handout that was on Brightspace for you that kind of looks like the one I have here. Fill in as I go. It's real important for you to understand these steps. It's going to help you with your patient care, your athlete care, whatever your job is. It's going to just help you understand where the patient is and get them to an environment that's more conducive to healing. And so let's jump right in, right where it begins at the initial injury. And since we're in an upper extremity injury course, let's just go with getting elbowed in the arm really, really hard. So maybe up in the deltoid region. And the minute you get elbowed there, your body feels pain. And that pain feeling is going to help start the inflammation process. And we learned yesterday that we need that inflammation process to start the healing. If we don't have inflammation, you don't heal. You get in this chronic state of an injured tissue, which just gets worse over time. So let me talk to you a little bit about this pain. We're going to see it occur in a couple different regions, in a couple different ways, I should say. And the first is, remember when we have an injury, our body has nerves that are called nociceptors. And those nociceptors are nerves that are specific to sending pain impulses to our brain to tell us we're in pain. So initially with that elbow to the deltoid region, you feel that pain. Some of our nociceptors are picking up that impulse and just telling your brain you're in pain. Another way that we feel pain is through chemicals. And these chemicals come in many different forms. I'm going to give you two that you can just kind of be familiar with when you start reading more scholarly work. Prostaglandin would be another. So bradykinin, prostaglandin are two chemicals that our body gives off that are called pain facilitators. And so they too are telling us you're in pain. Let's start this inflammation process so we can start to feel better. And so that's where we are. We get some pain. We go right to inflammation. Remember the signs and symptoms that we went through in class yesterday. I want us to look at this pain right here, incorporate it with that. So where does this pain come from? Well, when we're in the inflammation phase, even on a small cellular level, you are going to have this swelling. Swelling is going to put what we call mechanical pain now, mechanical pressure on the nerves. And if you have something pressing on a nerve, that increases pain. So far we see pain from just the nociceptors being injured, from chemicals that are given off at the injury sites, telling our brain that we're in pain. And as the inflammation begins and we have all of these processes occurring, we'll have the swelling, the injured cells or the dead cells and all the fluid that's coming through the vascular supply, applying more pressure on nerves, giving us more pain. You felt it. You know what that's all about. But what does our body try to do to combat that? And what it's going to try to do is it's going to kind of contain that. We learned that initially with on a vascular supply, we see that vasoconstriction, where the blood vessels go into a vasoconstricted form to try to contain the area, and that's in that 10 minutes or so. But remember, that's only 10 minutes or so. So what happens after that? Well, remember, we go into vasodilation now. And with vasodilation, that's down the road a little bit, but we're hoping to help clean up the area, but that's not where we are right now. We're more at the beginning of this injury phase and how we need to make an environment that's conducive to healing. So not only does the spasm occur on a vascular level, it's going to occur on a cellular level. And so if we're in a deltoid muscle, those are going to be muscle cells. I can't even spell muscle cells. M-U-S-C-L-E, muscle cells. And it's also going to be on a tissue level where all those cells come together to make up the muscle itself. So we're going to have cells on an individual basis try to get tighter, so to speak. That's kind of a weird way of saying it, but that's kind of what's happening. And we also know that the whole muscle itself is going to get tighter. What happens when you see an elbow coming at you? If you see it coming, you're going to tense up to try to lessen the pain that's going to occur from that. And so think about this. If we've got a vascular supply, or the vessels themselves, the cells, and the cells that make up the muscle go into spasm, what do they need to do to maintain that constriction? Well, they need to have oxygen and different nutrients. When I do this class in our lower extremity, I talk about those of you who are athletes or who maybe just in conditioning, you perform that exercise where you're doing a wall sit. You're in a squat position with your back against the wall, and it's for quads, hammies, glutes to get stronger in that isometric contraction. But you can only hold it so long and your legs give out. Why is that? Well, it's because we use up our supply of energy. We use up our O2, we use up all those nutrients, and we can't hold it anymore. Isn't that the same thing that happens on this level? There's only so much oxygen nutrient that will get to that injured area. And if you remember correctly, if we have a vascular supply that's compromised, we already have a diminished amount getting to the area. If we have a diminished amount and yet we're asking for a greater supply, then the thing that occurs here is what we don't want to have happen, and that's going to be cell death. We have cell death. This means due to hypoxia. Hypoxia simply means not enough oxygen, lack of oxygen. If we have cells die, where do these dead cells go? They just continue to fill up that injured area. So if we're in that deltoid muscle area, all of a sudden, not only do you have the cells that were injured, that are dead and dying, but now we have a secondary group of them. We call it secondary cell death due to hypoxia. That is actually going to it's actually going to fill in the area as well, creating more swelling, creating more debris. When you have all of that in that region, think about it, it's going to create even more pain because more nociceptors are going to have more mechanical pressure on them. More pressure, more pain wants our body to even spasm even more on these 3 levels, which means we need even more than that, but we're getting even less than that because our blood supply is diminished. So we're going to see an increase in cell death, which is going to increase the pain, and there you see that nasty cycle. So we've got a cycle that's going on and on and on that we need to, in some way, contain. Well, where do we contain that? I'm going to tell you, it's going to be right here, and we do it and you probably don't even know that you're doing it in a way that's containing the injury and giving us a good environment for healing. And we do it by applying the RICE method. Rest, ice, compression, elevation. Rest means we're not imposing any demand on an already demanded tissue, so it's not going to have more cell death. Ice is important because it helps decrease cell metabolism. Decreased metabolism means we need less O2 and nutrients. Less O2 and nutrients means we have less cell death, which means we're going to have less pain, which means we're already creating a better environment. With compression and elevation, we'll put those 2 together. Compression and elevation have a direct impact on swelling. They're going to decrease the amount of swelling in the area, which means we're going to have a decrease in mechanical pressure, which means we're going to have a decrease in pain, which means we're going to need less of a spasm, less O2, and we'll have less cell death and less cell pain overall. So RICE is probably one of the best ways we can help break up this pain spasm, pain cycle. Unfortunately, one of the first things we do when we feel pain that lasts for any amount of time is we take NSAIDs in the form of ibuprofen, Aleve, whatever. Whatever you're taking that's an NSAID. And sure, it's going to feel better because we have a pain reliever, but the problem is this stands for non-steroidal anti-inflammatory drugs. We need inflammation because inflammation starts the healing process. So right after an injury, it's not smart to take an NSAID. There are some pain relievers that we can take that aren't NSAIDs though, and those are going to be acetaminophen. You know these in the form of Tylenol. A Tylenol isn't an anti-inflammatory, but it is an anti-pain medication. Think about if you've had surgery or someone you know has had surgery recently. Most cases, the doctors aren't telling them to take something like this. They're telling you to take Tylenol because they know you need to have inflammation. And by having inflammation, we're starting the healing process. So this is just some food for thought for you. Hopefully this, although the end product looks nasty, if you followed me all the way through, hopefully it makes sense for you. If there's an area that's not clear, just make sure you're making notes on that, and I will help you get that when we come to class on Tuesday. Have a good weekend.